Hi, welcome everyone. Welcome to the partnership at Drug Free New Hampshire's Prevention Week Facebook Live series. I'm Julie Yerkes and I'm the Community Engagement Director at the partnership. And we've invited prevention specialists from a variety of roles across the state to join us each day this week to share their prevention story, their expertise and their experience strengthening community, building resilience, and creating hope. And I'm really excited to have Rebecca Lerner with us today. She's the Student Assistance Program Counselor for Nashua North High School. And she's here to join us to talk about today's topic, preventing substance use and promoting mental health in youth, which is the role that those student assistance counselors have at our schools, and we're so fortunate to have them. So welcome, Rebecca.
Thank you so much for having me, Julie. I'm super excited to be able to be on here and talk to you about what we're working on.
That's great. So yeah, so as in your role as a student assistance program counselor, how do you work to prevent substance use, substance misuse, and promote mental health at in your school?
So I'm very, very lucky to be part of Nashua North, who supports our program 100%. That right there has been one of the biggest helps in promoting the program and getting kids to buy into coming to see us and talk. Um, from the beginning, one of the ways that I've been able to maintain a caseload is if a kid goes to their guidance counselor or their assistant principal and talks about use, either themselves or someone that they are living with or no, they get referred to me to work on either how to handle having someone in their home using and navigating the stress that can come with that, as well as I use the project success model on working with kids to decrease and ultimately end their own substance use. I also get referrals from kids that are actually using in the school during the day, mainly vaping, which has, especially over the pandemic years, become a very large problem in the schools just because we didn't have that connection to the kids. So, we were virtual for a few years. The teachers and everyone here didn't have that face to face support to give the kids. So, unfortunately, coping skills went to the wayside and substances were picked up. Um, so a lot of those kids that I was working with previously have come back for extra support, which is great that a lot of the kids are realizing that their own mental health has suffered a little bit over these last couple of years. And they are able to say, hey, I know we haven't talked in a little while, but this is what I'm going through. I also participate with the health classes every semester. So I run a program that is about 4 days long there, and we go over everything from mental health, substance use, to healthy relationships in general. And the kids have the ability to ask questions, talk about personal experiences, as well as um, promote themselves for the program and tell me after the class is over that, hey, this is something I'd like to participate in. How does it work? I always have an open door policy with my kids as well, that if there's something going on that day, you don't need to wait for me to call you down. Come down to the main office, ask for that support, and come on in to talk. And I think that has been a very big help for the kids to know that not like outside therapy where you have 1 hour a week and that's it. This is something that they can utilize throughout the week, throughout the day, whatever support that they're truly looking for. We've also done presentations by grade, specifically on vaping and the dangers that are associated with that.
Yeah, that's great. So and that kind of led, that was one of the questions I was going to follow up with, and you touched on it a little bit, but so students are referred to you, right? If there's some risks identified by teachers or administrators, or even maybe self referrals, right? Needing some support, but then you also have a greater presence at the school, and you're educating, the whole school and whole classes or whole grades, right? The greater student body.
Yes.
So, and you touched on this a little bit too, but I wonder if you can speak more to it. Today's topic is preventing, substance use and promoting mental health in youth. Why are those two part of the same topic? And you spoke to young people, being away from school, having, losing some coping skills and using, substances perhaps as a coping mechanism. But could you speak a little bit to the relationship between mental health and substance use and how you work to, what that looks like to make that connection and improve that for our young people?
Unfortunately, even in this day and age, mental health is still extremely stigmatized. Getting help is looked at sometimes as being weak, or a kid doesn't want to be seen as broken. So they hide that anxiety and they'll push that depressive feelings down and try to pretend that everything's okay. By doing that, they're not building those healthy coping skills necessarily with the depression and anxiety. You stop wanting to do the sports that you're playing. You disengage from certain activities that you were utilizing beforehand to promote that self-awareness and those healthy coping mechanisms. So in the high school age especially, kids are starting to experiment with substances, and they will feel in that immediate moment that, hi, you know what, I feel a little bit better. Things are getting better, not realizing the correlation between your serotonin and dopamine being created in the brain and the substance they're using, repressing the natural creation of that. So addiction is happening because when we, especially over these last 2 years, didn't have those close relationships, kids weren't being able to participate in their sports. They were unable to see teachers, that they really enjoyed talking with and getting the support that way. So their only mechanism a lot of times was, well, my friend said that when they're sad, they would smoke marijuana or they would vape and it would make them feel better. A lot of kids were, especially over this time, mental health needs increased, and there are 6-month-long wait lists in some areas for kids to get the support that they need. So what can they do to self-regulate, because they're not learning some of those skills from people or professionals that they would normally have? So not having those supports. And unfortunately, with teenagers, yes, we do see experimentation in general. That has happened before, but the increase due to the mental health needs has been kind of numbers that we've never seen on our end before. There are a lot more kids that I really am getting referred to me that when they come, it's like, yeah, I used, but this is why. And they're really opening up about, I've been suffering from depression. I was the star soccer player and now I can't even make it to practice because I'm just so sad all the time and I don't know why. So while the referrals are coming for the substance use, we're noticing all of that underlying issue is the mental health related problems of, I have, my juniors or my sophomores that haven't been in school since middle school. So they never got that full transition. The anxiety when we had to come back was extremely intense. These schools are very big. So trying to
Right.
learn that as a junior is very different than having that experience as a freshman. And it's an escape, a lot of the kids are
Yeah.
saying as
Right.
well, which is the biggest thing, is just, this is what I'm trying to not relive every day, is this trauma, or I don't want to remember that, I'm failing one of my classes. So I
Right.
go home, I try to do my homework, I get too stressed out, but I can smoke and, forget about it. So a lot of what we're doing is rebuilding that self-confidence, rebuilding those coping skills on, okay, what's a little thing that you can do? Um, It's very, very rare that I see a kid that is not having something underlying that is causing that use to happen. So
Right.
it's a lot of just that balance.
And you struck me with, experimentation, right? Adolescence is a time of experimentation, and maybe a lot of parents remember that time, or we still don't want our adolescence because we know it has a
Yes.
negative impact on brain development to experiment, but experimentation is different than using substances as a coping mechanism, as an escape,
Yes.
as a way to try to feel better, as opposed to I'm at a party with friends having fun, right? And I'm going to try
Yeah.
something, right?
Yeah,
Which
that
is also
section of
not a safe thing to
experimentation
do.
is going down,
Mhm.
and just going to straight use is on the rise.
Problematic use. Yeah. Yeah. Um, there's a question in the chat, and asking, thinking about back during the pandemic when the students were not in school, how were you able to connect with your students during the with the challenges of the pandemic, and were you able to? I know that every school district had different resources to be able to do that and different protocols. What was your experience?
So we were very lucky that telehealth was able to be utilized during that time. So for the kids that I had already been meeting with, I sent emails to their parents and the student themselves saying, "Don't worry, we are still here. Send me an email at any point during the day. I will be available from 8 to 5 on DoxyMe, which was a different setup, a little safer for therapy than a Zoom call, a little bit more controlled, and you HIPAA, all of that safety things. So a lot of my kids reached out after I emailed them and said, yes, I would still like to participate in these meetings. I would like to talk via DoxyMe. And in the beginning, it was great. And then, it did get hard because the kids are in school 8 hours virtually. So the last thing some of them wanted to do was to, again, have another virtual session. But I
Right.
did notice that a lot of kids were very appreciative and did want to utilize that. And we still did get referrals from parents, especially reaching out to guidance saying, I've noticed. I think I found a vape in my house. I think it's my students. What supports are still offered? So we were still very, very present during that time. I was still meeting with kids pretty much throughout the whole school day, working with the teachers to let them know if they did notice anything to please tell me, because they still had face-to-face sessions as well. So we were still able to have those meetings, still have that connection to the kids, and give them the support at that time.
Great. Thank you. Um, you know, Rebecca, I know that as a student assistance program counselor, you work with the students, which you've just described, but I know that you also work with teachers, administrators, and parents, and then community members as well. Can you share a little about how you work with those different groups? And I think most importantly, what messages you'd like to share with our listeners about what we can each do in these different roles to support our young people in our lives.
So one of my favorite things is that at the parent open houses and teacher conference days, we set up a table. So we put the SAP program out there for parents to be able to come up and speak to us about, as well as the Student Against Destructive Decisions Club that we run
Mm.
in the school. So we run that to reach not only the kids, but the teachers and faculty as well. I get amazing participation during the events we do during the month from the staff to show that, they help the kids, show to participate, to interact with us, and to learn. So at the parent teacher nights and the open houses, I've had a lot of parents come up and ask what our program is, to be able to give them information about it and let them learn this support is here, not just for the kids, but for them as well. Especially when I work with a family that has an unfortunate loss due to a substance issue. I, will talk to the parent and let them know about the grief counseling that I'm able to do with their students and give them that support as well. So anytime a parent reaches out, I am more than happy to give them resources, let them know how that support works in the school. I work with the guidance and APs the most on just, meetings, on schoolwork. I allow the kids to come in to the office after meeting with, a guidance counselor, that if they need a quiet place to do work because they're overwhelmed, they can come down here. And we've also even done trainings for the teachers and the staff on vaping, on what to look for, on what to kind of notice, and even behavioral changes in the students that they're working with. Of, okay, we had this student that was, an AB student, very active in participation, and now all of a sudden we're kind of seeing a distance from them and their grades might be sliding. It doesn't necessarily mean it's a substance use, but that's something to bring to us to say, hey, maybe if you can check in on this student, I'm concerned. And we have that open communication. And then especially after these last couple of years, I was able to meet with all of the teachers in the school and sit in on their staff meetings and introduce myself in the program, because while I have been here for 5 years, there are some teachers that still don't necessarily know about what we offer and how it works. So I was able to really sit and talk with them about the program, and they were so welcoming and so open and excited that we had that here to learn more about. And I think, especially for just the community in general, one of the most important things that I can say is just open dialogue. The stigma behind both mental health and substance use, if we can lessen that stigma and really support people that are going through these crises at these times, there can be so much healing that can be done. If we look at it as diseases, as something that this person needs support through, rather than that, oh, well, this person has that problem, but it's not my problem. Unfortunately, this does affect communities. It affects everyone. And if we can just show a little bit support, educate ourselves, there's so many resources out there. Just asking questions is something that can be hugely important to getting support to people that need it.
Thank you. And we heard that yesterday too, when we were talking to Celeste Clark, the Raymond Coalition for Youth, asking, talking, listening in an open and non-judgmental way, and really, trying to understand where our friends and our, well, in this, we're talking about youth today, but, what they're going through and what they need, and what kind of support we can provide. And just really being able to open up and listen, and not be judgmental and stigmatizing, right? And afraid of the answer, because there's support out there. Well, thank you. We did want to kind of keep this around 15 minutes. We do have a question in the chat, and then I have a couple other resources I want to share. But Darren Smith has asked if, as an SAP, you are, if you have any resources or support services that are missing or that could help the kids if you had them available. So is there something you wish you had access to link to the kids that you don't have right now?
Yes, there is. Yes. We are definitely noticing for our youth a lack of substance support. A lot of things are at 18, you're golden. You can go to different treatment centers and get that. I mean, I do work with kids that have some very severe use issues, but unfortunately, there aren't the facilities that work with kids that are under 18. Yes, there are some teenage meetings that they can go to, but not the as strong work that can be done. And I've recently talked with some senators about funding some youth programs so that the kids can get the support and not have to wait 3 more years until they're 18 to be able to get it. And that would be my dream, is that there's not that age limit on that help.
Thank you. Great question, Darren. Thank you very much. So if that is something that you've seen too as a listener, please contact your legislators and show that support as well for that. I do want to, if you have any questions for Rebecca or about the SAP program in general, if you have one in your school, you can email the partnership. And my colleague's going to put that email in the chat so y'all can find that. We have a lot of resources about how to have those conversations, things that you can do to support young people at the community level, at the school level, and at home on our website at drugfreenewhampshire.org. And I do not want to miss the opportunity to share that today is also National Fentanyl Awareness Day. And we do know that fentanyl has been having an extreme impact on young people of all ages across our country recently, in that it is very, very lethal, and it is being used in a number of counterfeit drugs that a young person might use to experiment, or it might be a party drug, just to go have fun, or it's being camouflaged, I guess, in prescription medications. There's a host of wonderful resources on fentanylawarenessday.org, the website that was just put in here. Information about fentanyl, resources, talking points, toolkits if you're on social media and you want to share it. So just definitely wanted to make sure that we're all aware of that today as well. So Rebecca, I can't thank you enough. Listeners, email us at the partnership, visit the partnership Drug-Free New Hampshire .org website to get some information about overall prevention activities and options for you. And we hope you'll join us tomorrow for our third day of this. And tomorrow we are talking with Jennifer Saban from the New Hampshire Suicide Prevention Council, as well as Jody Longiletti from OCD New Hampshire and Dover Mental Health Alliance on suicide prevention. So we'll see you same place, same time. Thank you, Rebecca, and I'll talk to you soon.
Thank you, Julie.
Take care.